Okay, last but not least, I want to look at a few of the other parameters that we can adjust just to really round out all the different features that Infirmary Integrated does have. So if I make this a large screen, there are a few tracings, and this is mainly related to critical care and potentially emergency nursing and medicine. But there are tracings for intracranial pressure and pulmonary artery pressure and intra-abdominal pressure. We do have central venous pressure as well, and we can select all 12 EKG, or yes, 12 lead EKGs, but we'll go over the 12 lead EKG in just a minute. So I did just want to point out that we are able to set up very much like a cardiac surgical ICU or a cardiac ICU. We can set up all the different cardiac parameters, including simulating a Swan-Ganz catheter, and such as on a neurocritical ICU, we can set up the intracranial pressure. So there are a few features here that I do want to point out. Obviously, with the central venous pressure tracing, you can adjust the central venous pressure. So the central venous pressure can be adjusted under advanced hemodynamics. So if I increase up to 8 or up to 10 and hit apply, that change will propagate to the simulator. It's also possible to change. Now, you may have noticed some artifact as the model was updating the waveforms. That does happen, and it does take a couple seconds for that artifact to fall off the screen. The pulmonary arterial profile. So under advanced hemodynamics, we can actually simulate, for example, you could run a simulation teaching students how to recognize changes on the cardiac monitor while a Swan-Ganz line is being advanced. So if I actually, this would be better to hit auto apply parameters, and then sorry, the pulmonary arterial pressure was alarming because as I switched the line to the right atrium, all the pressures fell out of the normal range. So I apologize for that alarm. That was obviously part of the simulator. That is intentional. So having switched the pulmonary artery catheter placement to the right atrium, it clamped all the actual pressures to what would be normal of a right atrium, right atrial pressures. And the waveform is essentially an auto-scaled version of the CVP, the central venous pressure waveform. So true to life, when you change the position of the PA catheter placement, the waveform and the pressures do change. Of course, it is possible to set up a scenario where the pressures change. Instead of being the default normal pressures, you can, using the scenario editor, set up a scenario for someone with pulmonary hypertension or other, visualizing other types of cardiac failures. So I'm gonna now advance the PA catheter into the right ventricle, and we should see a response of a now and RV pressures. So we see the numerics have updated to a pressure of 23/-2, which is just that bounce back pressure, that negative deflection. And we have a waveform of a right ventricular pressure. And as I proceed into the pulmonary artery, I'm going to then see the typical or the standard PA pressure waveform. And having changed that, it did adjust the PA diastolic pressure to a normal pressure. And now we see that the waveform has also changed. And I can toggle auto scaling, and we will also see this auto scale for a larger tracing, a larger drawing. And last but not least, we can now set to a pulmonary capillary wedge, and we'll see the tracing update to a wedge pressure. And I've also, the vital signs automatically clamp to a wedge pressure. If you want to set up a scenario using the scenario editor where the wedge pressure is not your default or normal hemodynamic pressure, you can absolutely do that as well. There is some intrathoracic variability that we're seeing in the waveform. As you can see, some of the waveform peaks are falling off the tracing because they're higher, and some of them are normal, and this does coincide with the respiratory cycle. So we do have intrathoracic pressure at play here. I'm now going to lastly show intracranial pressure. There are some unique simulations or simulator facets about the intracranial pressure in infirmary. And I do want to show this. So the intracranial pressure, much like hooking up a regular intracranial pressure bolts or catheter to a cardiac monitor, we have an intracranial pressure waveform tracing. The auto scaling, the labels, actually, I'm going to have to fix that because those labels aren't actually supposed to show on the intracranial pressure, but it's not actually auto scaling, obviously, because a peak pressure of 8 doesn't lead to this 144. So we can ignore that and it'll be fixed in a future release. But what we do see here, very much like a normal ICP hooked up to a cardiac monitor, we see the ICP pressure and the cerebral perfusion pressure. The cerebral perfusion pressure is, if I change some blood pressure readings, I don't remember off the top of my head if it must be taken off the arterial blood pressure. So when I change the arterial blood pressure readings, the cerebral perfusion pressure calculations updated and the cerebral perfusion pressure changed automatically. So the monitor does, much like normal monitors, calculate cerebral perfusion pressure and update that. The biggest unique feature that Infirmary has about intracranial pressure as well is that as we get to a abnormally high intracranial pressure, much like on a normal human being, the waveform begins to dampen as the actual brain loses compliance for those high pressures. So under advanced hemodynamics, if I start to really turn up the intracranial pressure, we're going to start to see the waveform modeling reducing compliance. And this happens on a sliding scale. I've already started to see the waveform alter a little bit. And as I increase it, you start to see some of the peaks and valleys kind of not get so far from each other. So it's a bit of a hard thing to see on the moving tracing, but I did see it as I was adjusting a little earlier, and if I drop the ICP rapidly, we should see a very rapid change in compliance. There it goes. It went from the left side to the right side. We can now see the waveforms have changed significantly. So actual cerebral compliance, and I'm changing it again, is modeled as you have increased ICPs. And that's a feature that was specifically implemented to help simulate some of those critical care and emergency circumstances. I'm going to stop this segment and we'll do our next segment on the EKGs.